Now, ladies and gentlemen, let's welcome Dr. Wei Wei Wee Stekly.
Thank you, James, for your kind introduction. Hello, everyone. My name is Dr. Wei Wei Wee Stekly, and thank you for inviting me here today. Today, I've been given a very big topic. We're going to talk to you about women's health at work, thriving through the 30s to 50s. I've only got 20 minutes, a very big topic for me to focus on. So I'm just going to narrow dive into menopause, which I'm sure a lot of us will want to know more about. So let's dive right in. So what is menopause? Menopause is 12 months consecutively of no period. So just a little bit of stats. NUH did a survey last year and found that the age of menopause averagely is 49. That has come down from 50 to 51 many years back. More than half of midlife women in Singapore experience moderate to severe menopause symptoms. So what are the signs and symptoms of menopause? We all know hot flushes, the familiar night sweats waking you up, your mood swings, anxiety, dry skin and vagina, loss of hair, thinning of hair, needing to pee frequently, especially at night, reduced sexual energy, low energy at work, joint pain and aches, brain fog, which simply means memory loss, unable to focus at night, unable to focus at work. And of course, if you have any of that, and if you're unable to cope with the symptoms, depression may ensue. So more about stats, 90% of women say their workplace offer no help for menopausal women workers. And the main symptoms that they complained will be 73% hot flushes, 63% being lethargic at work, 48% low mood, 47% unable to focus and concentrate, 43% having troubles with their memories. 34% of women develop depression and anxiety, and almost 30% say that they've lost confidence at their workplace. So important to take note. Depression during menopause is something we underdiagnose. Certain women are more susceptible to depression and anxiety during their menopausal journey. So if you experience any of these symptoms, please do not suffer in silence. Please seek help. So how do we diagnose menopause? We can do a blood test. It's called FSH, which stands for follicular stimulating hormone. Anything more than 30 diagnose you to be menopausal. However, one blood test may not be totally representative. You need at least 2 to trend. Alternatively, you can just go clinically. If you have any menopausal symptoms coupled with the fact that you have normal menses continuously for 12 months, that puts you into the menopausal category. So what are the common myths of menopause? Let's have some fun. So myth number 1, menopause only occurs in women over 50. Now this is false. Menopause typically occurs as early as 45, sometimes earlier. We kind of follow our mothers, so find out when did your mother menopause, we'll follow the same. But it can happen earlier than 45 due to many reasons, including genetics as mentioned, or if you've done repeated surgeries on your ovaries. Myth number 2, menopause means the end of a woman's sexuality. That's false. Sexual health can remain positive as part of your life with proper support and guidance. Some women even report an increase in libido after menopause. Myth number 3, weight gain is inevitable during menopause. Now this is also false. While weight fluctuations are very common, maintaining a healthy weight is possible with exercise and proper diet. The next myth, hot flushes and night sweats are unbearable and unavoidable. Now this is also false. The frequency and severity of hot flushes and night sweats will vary from women to women. Some women do not have symptoms at all. There are various options available, and including lifestyle adjustments and medical treatments. The next myth, menopause is the same for all women. False. Menopause is a very personal journey, and symptoms can vary in severity and the type of symptoms. So some women, they don't even experience any symptoms. I always tell my patients this story. My mother in her 40s definitely would have benefited from HRT. We were all tiptoeing around her at home because she had outbursts of temper and nothing seems to be going right. Everything is wrong with her. And my mom would have benefited. My best friend Audrey's mother, same age, both born in the year of dragon, never had any symptoms. She was like an angel compared to my mother. So not everybody goes through menopause the same way. Next myth, HRT is dangerous. Well, this is false, okay? It can be safe and an effective option for managing your menopausal symptoms when prescribed by a gynecologist or a GP who's experienced in the management. So let's go to the management of menopause. So important to have a balanced, healthy diet, which includes important things like increasing your protein uptake. Taking multivitamins is important to fill up the gaps of what you're missing in your diet. Adequate sleep, such a luxury. But if you can aim for 7 to 8 hours per night, that would be ideal. Exercising regularly, and I'm talking about 2 to 3 times a week, include cardio, include strength training to build your muscle mass, which is so important nowadays. Quit smoking, and that includes vaping. Reduce caffeine and alcohol, because obviously that will not give you a good sleep. Adopting meditation and breathing exercises to be able to cope with your moods better. Taking up a new hobby to make you feel better, to occupy your time, to have a breathing space. I think that's quite important. Taking isoflavone extracts like menoflavon, which contains the phytoestrogen, may also help in your symptoms. Tibolone, which is a synthetic steroid hormone. If you're menopausal for 1 year already, that may be an option for you. And of course, the famous Vioza, which has been marketed in Singapore since a year ago. It plays with the thermoregulation center in your brain to make hot flushes better. Then we have HRT, and HRT comes in many different formulations. We have the estrogel, we have the oral form, and I'll come to that much later. Of course, you also have antidepressants, anti-anxiety medications, and sleeping aids if you're unable to sleep at night. And most importantly, support from your family and friends. I think that is always understated. So management for you during menopause should be personalized. Not sure why that's wrongly spelled, but yeah. So do not suffer in silence. Please seek help. So let's talk about HRT. So many different types of HRT, and I'll start from the top. We have the estrogel, which, of course, if you still have a uterus inside in your body, you will need to protect your uterus with oral progestogen or a Mirena, which is a hormonal coil that you put into your womb. Next, we come HRT patches and implants, which is not so popular in Singapore, but that can also be an option for you. Then most popularly in Singapore, we have the oral HRT. We have the cyclical regime and we have the continuous regime, which I'm sure your gynecologist can talk to you more about the brands when you seek help from them. And lastly, ad hoc treatment. If you have a dry vagina, vagina estrogen may also be the treatment for you. So what are the benefits of HRT? Very, very effective in relieving your hot flushes, night sweats, insomnia, mood swings, your mood changes, vagina, skin dryness, makes you feel young again. And so we all know it's a miracle therapy for menopause. And of course, it prevents osteoporosis. And with that, it prevents your risk of fracture as well. And by managing your menopausal symptoms, HRT can improve your quality of life. But what are the risks? Risks are plenty, although I would say the risks are small. So it can increase your risk of blood clots and stroke. It can increase your breast cancer risk if you use it more than 5 years. It can increase your risk of womb cancer if you do not take the appropriate protection. And of course, if you take it more than 10 years after menopause, it can also increase your rate of heart problems. We all know that HRT is popular in increasing your gallbladder disease, including increasing the production of gallstones, and of course, all these side effects that comes with taking hormones itself, like nausea, breast tenderness, headaches, fluid retention, and irregular bleeding. So what are the factors influencing risk? We have age. If you're very close to menopause or you just started menopause, then I think the risk is very low. But if you are already 10 years after menopause or you're close to the age of 60, then starting HRT will confer you a higher risk. The type of HRT, oral has higher risk than estrogel, obviously. And of course, if you use it the shortest duration, lowest risk, longer duration, higher the risk. And we also look at your individual health history. If you have a family history of breast cancer, or if you have formed clots in your legs before, we would say HRT will increase those risks as well. And like I said, oral estrogen will obviously be of a higher risk than going through your skin or patches. So what is my opinion? I think important to consider with your gynae when you see them, that your approach needs to be personalized according to you. Not everybody goes through the menopausal journey similarly. Okay, so it's important to have the decision made with your gynecologist, discussing the pros and cons, whether you need it or you do not need it. And the game plan is to use the lowest dose, safest mode of delivery for the shortest duration so that you get the least side effects and risk from HRT. And bear in mind, if HRT is not suitable for you, we have other types of medication to treat your symptoms. For example, we have antidepressants, we have sleeping aids, and of course, all the lifestyle managements that we can discuss with you to make your life better. In my opinion, if you're experiencing symptoms of menopause that are impacting your quality of life, and if you wonder whether you need HRT or not, the decision is a very individual one. Okay? HRT is very complex and it's not for everyone. So if your neighbor is on HRT, it doesn't mean you need to go on it as well. Okay? So it's important to discuss with your gynae if HRT is right for you. Discuss the risk and benefits of HRT. Discuss about the pros and cons of the different types of HRT available to you. And remember, even if HRT is not suitable for you, there are other types of treatment options that we can discuss with you that may be suitable for you. So this is a picture of my mom. So we went to Bhutan in August last year. And remember I said my mom would have benefited from HRT in her 40s? I never used to be able to travel with her. The moment we talk, we argue, okay? Just very different people, different opinions. And look, we went on a mother-daughter trip to Bhutan. And look, she could climb 7 kilometers with an elevation of more than 1,500. Tiger's Nest is, I think, at an elevation of 3,200 above sea level. And my mother could do a 6-hour hike full of energy. Now her temper is much better, and we are best of friends. So all I'm trying to say is, menopause is not an illness. Menopause is just a transition, okay? Things will get better. In Asia, we call it 2 to 5 years. In the Western world, they say menopausal symptoms settle over 7 to 8 years. Makes me think Asian women are more resilient. But anyway, symptoms can vary widely in type, severity, and duration. Your mental health can be significantly affected, and therefore support from friends and family is very important. So we all know by now there are many effective treatments and management strategies available, and it should all be individualized to you, to what you are going through. So open communication and seeking the right gynae whom you trust is crucial. So this is my last slide. I just want to tell you that ONG is not all just about menopause, right? So if you start as a younger lady, 10 to 19 years old, you might have like menstrual problems, vaginal discharge, pregnancy, if you have early pregnancy, puberty-related conditions. In your 20s to 30s, contraception becomes very important, STDs, pregnant, most people get pregnant then, PCOS, endometriosis, fibroids, the next century and menstrual changes. This is when perimenopausal symptoms will start, pelvic organ prolapse because of childbirth, gynae cancers, and of course, after 60, all of us want to rule out cancer, urinary incontinence becomes a problem, and menopause. So it is so important to increase awareness and educate women with regards to all these conditions. So regular checkups, important. Early screening for cancer, important. So that we can detect early and render you the appropriate treatment. Thank you, everyone.